Hi guys, it's Sarah, and we are back again with Julie Patterson with another episode. And today, Julie is going to be telling us all about what foot zoning is. And so, Julie, thank you for joining the show. I know that you tried foot zoning, but I don't know what it is. When I think about foot zoning, my mind goes immediately to reflexology. But can you expand a little bit on what foot zoning is and what drew you to try it?
Yes. So to start off right away, that is what most people think of as like a foot reflexology. And to be honest, I have not ever had a session of just foot reflexology. So I did actually look up what the difference is. And basically, reflexology is based on like the patient's symptoms, and they still work the foot mapping with both the foot zoning and the reflexology. However, the reflexology technique can be both feet or one foot and is symptom based, whereas foot zoning runs a specific pattern every time with each foot. So it's both feet every time, and every time they do the same protocol. And the reason is they're not only working the physical aspects and finding out what's going on with you physically, but they're working emotional aspects and energetic aspects within the body, because as we know, the body communicates with itself. The organs communicate, our brain communicates, our nerves communicate with all of our organs. And so when they do a foot zone treatment, they're doing that protocol with the foot mapping, but they're also pulling in those other parts that make us who we are, and try to heal the body as a whole instead of one specific symptom that we might be suffering from. And the reason I was directed to foot zoning is some of your watchers may have seen the video that we did on auricular treatment. And that practitioner actually referred me to this gal that does foot zoning in our area. And he thought that it would be a really I don't want to say successful, but like a good modality for me to reach out to because of some of the nerve issues I was having and some other communication issues with my body. And so I went to her and saw her several times, once a week, probably a couple of months, once a week.
Okay.
I think maybe initially I even saw her a couple of times a week for a couple of weeks, but money being of essence, I had to be a little bit careful on how often. I would have seen her every day if I could have for a while, but
Yeah.
now I'm about every 2 to 3 weeks. And of course, depending on scheduling and her schedule, my schedule, everything else, but it's about an hour long. And as I said, they work both feet in a certain pattern.
Okay.
And sometimes I'll ask her, because you can tell different things are going on by what you feel like as the patient, but she can tell. She uses her knuckles in these areas on your feet, and she can tell also what's going on. But because it's combining the entire body in that treatment, sometimes she'll be working on my right foot, which she starts on, and then I'll ask her about a certain spot that maybe is a little more sensitive or maybe has a sharp pain or gravelly pain, type feeling or something to me. And she'll say, well, I'll tell you when I get on the right foot, because she's like, I have to kind of connect the dots on what I'm feeling in both feet in both areas. And so it's kind of a neat thing because she really is looking at the body as a whole instead of just symptoms. She actually doesn't even ask me really like what symptoms I'm having when I first come in. She just starts working on your feet, and your feet tell the story to her. So it's a really neat thing. You don't really even have to have that initial conversation of, okay, what's going on? What are you feeling? Why are you here? Type thing. Because yeah, as she works your feet, she can tell. And it's neat because you can see the progress. Like I said, I've been doing it for several months. I think it was probably June or July when I started seeing her. And initially, it does work on an emotional aspect as well. Initially, there'd be certain spots we'd just be chatting, like not even about health stuff, just in general, her kids, my work, whatever, and all of a sudden she would start working a spot and I would just break out in tears. But it would only last a couple seconds.
Wow.
And even if she was still working that spot, it was just kind of like a release, and then it would go away and I was fine again. And so that was kind of intriguing to me. And then as I kept seeing her more and more, I would notice spots that were either super tender in the past, weren't tender anymore, or maybe spots that used to make me tear up or break out in tears don't make me do that anymore. And so you can kind of like see the progress. And I just had a treatment yesterday, and I told her, I'm like, this is so weird. Like, you're working this whole spot on my foot that I remember I used to kind of cringe a little bit. I mean, it's not really like painful, but
Yeah.
I
Yeah. It
don't know.
sounds. Yeah.
And she goes, yeah, she goes, this is really like loosening up. And, they always use the peeling the onion with, they get to different layers with more treatments. And so she mentioned that, but she said, well, and trust me, I'm not going easy on you, and I told her, well, don't, I'm kind of one of those people that I like to know that I'm getting a treatment. I like to feel it,
Yeah.
And she said, no, I'm not going easy on you. It's just that, we're breaking stuff up and we're getting through where we need to get through. And it's just a neat thing because she's always on me about my lymphatic system. And it's always needing work. And so, I mean, the Footzoning treatment itself does work that and help get it moving and flowing and draining and everything like it should. But then she'll give me tips and tricks to try to do on my own as well to, get it rolling the way it should be. And then, if there's certain spots I ask her about, I'm like, oh, that's sensitive, and she'll say, oh, that's your mid-spine where I do have an injury, or that she's trying to work out, and there's one spot on one of my big toes that kind of works on a couple of glands, like in your brain, like the front of your forehead area of your brain. And that's always sore. Of course, I have some issues with neurological problems.
Yeah.
And so it always just impresses me, like where we were and where we are now and how I can feel a difference.
I love that. Okay, so backing up a little bit, describe what it's like as far as, are you sitting in a chair and you have your leg out like a manicure, or pedicure, or are you like laying on your stomach and she's like, and you're on a massage table and she's
at your feet? Good question. She has two places that patients can sit. She has kind of like a futon style couch or a chair that is like a single person chair. I usually sit on the couch. It just seems more comfortable to me. And then she has kind of one of those little like sitting ottomans that she sits on, and you just put the foot out that she's working on, which she starts with, as I said, the right side, and then she'll move to the left side. She does the whole protocol on the right side, and then she moves over to the left side. And so she moves herself around depending on the angle that she's working on your foot.
So she's like on a stool. Is this kind of like a pedicure?
Kind of like, it's like a footstool, but she sits on it. Yeah.
Yeah. Okay, cool. And then when you say she does the whole protocol with her knuckles, and so it's the same pattern that she does on your foot every single time. And is it like a good 30 minutes on the right foot and a 30 minutes on the left foot then?
Yeah. Yeah.
Before she passes over. Okay.
Yeah. It's for her treatment. Anyways, I've only seen her as the one practitioner, but it's a full hour. Yeah.
Okay, cool. And then similar to reflexology, I guess because that's the only thing I have to draw from. Does she do the pattern like over and over during that half hour, or does she like start at maybe the tip of your toe and press and hold it until she feels a release, and then she moves to the next point and the next point?
She's pretty much constantly moving. She doesn't like hold per se in a certain spot for a release and wait for a release, because it's not working on like a reflex, like waiting for that release, I guess. She's generally doing like a circular motion of some sort, and in some spots, like the vagus nerve spots are kind of like on the ball of your feet in between your toes, and so she'll go in between each of those joints, like on the ball of your foot with her knuckle, and like kind of jolt upwards. And she'll do that several times to try to like open things up and pathways up, but she's pretty much moving her knuckle the entire time. So again, like I said, circular motions, or sometimes a jutting motion, but Yeah.
Interesting. Where earlier when you said she told you to work on your lymphatic system, where's she rubbing when she says that?
There's actually a couple of different places because, as you know, we have lymph nodes all over our body.
Mm-hmm.
So a lot of it's around the ankle and just above the ankle, on both sides of the ankle. And
Mm-hmm.
then there's some spots that are further up on the foot, like closer to the toes. But it depends on where it is, like the lymph nodes in your neck versus the lymph nodes in your
That makes
knees and your
sense.
ankles, and
There's different
the ones
spots
in your
under your feet.
collarbones. There are different spots on your feet.
That makes perfect sense. Um, do you notice, like, have you ever noticed if you went in with swollen feet and then you leave with your feet not swollen?
I wouldn't say the same day, no, but yes, within a day or so, I'll
Okay,
notice a difference. Hmm.
that's
Yeah,
pretty cool.
yeah.
Um, do you have? Sorry, I have like a kitty hair on my face. It's just tickling. Um, do you have emotional releases like you mentioned? Like later after the session, do they linger for the next several days?
Initially, I did, and it wasn't necessarily like over a couple of days, but it would be like I would have a session, and then say we would run an errand later that evening,
Hmm.
and all of a sudden I would just start crying for, again, maybe just a minute, maybe 30 seconds, 60 seconds,
Yeah,
90 seconds, and my husband would be, you know, like, what is going on? Like, why? And
yeah,
and I would say, it's just me, it's just me, it's just, you know, something, I had a treatment today and it's just something that's coming out. And
yeah,
like, I literally couldn't control it, but it wouldn't last long enough to matter. And
yeah.
honestly, like, we might be driving home less than a mile from home, and by the time we were home, I was fine, you know?
Right.
So
And so it's literally your body is relieving some sort of pent up stress or something, but
yeah,
you're not actually like emotional and stressed when that's happening.
right. I mean, you might have like some physical, you know, feelings of stress
In
or
the
the
moment
emotion, but
as it's
like, I
releasing.
can't pinpoint it when it happens, you know, but I know, I mean, I've done enough of these different modalities that I know it's a release of some sort, because it makes no sense otherwise, you know? So,
That's interesting. What other kind of releases, like kind of going into like, does it help with constipation? Does it like, have you noticed any other releases later besides emotional?
I'd have to think about that, because each time's a little bit different. And like I said in the beginning, I had more of the emotional releases in the beginning and
Hmm.
not so much now. I would say definitely helps with digestion and such. She doesn't work on that as much with me, but she can also tell where there's inflammation in the body. And so you'll feel like maybe, you know, if she's working, as she's working, she finds areas like that. Like the next day I might be sore, even though she only worked on my feet, but I might be sore like in my shoulders or in my legs or in my hips. This last time she kept finding things in my hips. And so, ironically, today my hips were quite sore. So,
That's pretty.
you know, it's interesting for sure.
Yeah. Um, have has it helped with pain, like overall chronic pain that you've been dealing with, nerve pain, after you've been seeing her for as long as you have now, several months? Do you
Um,
feel like you have less like nerve pain or body pain?
it varies. And the reason I say that is, I'm a work in progress for sure with
Yeah.
the neurological things that I'm dealing with, but um, where I can really tell is like the areas that she's working on my feet
Hmm.
themselves.
Hmm.
Um, I definitely see it helping in other ways, but as far as chronic pain, um, I don't really deal with chronic pain as much as some people would with like, I do have fibromyalgia, but I don't acknowledge a chronic pain as much,
Yeah.
as just a generalized soreness, and that kind of comes and goes.
Okay. Gotcha.
So I like, after a treatment, I'll be more sore than I would be, you know, without a treatment for a while, which to me is a good sign because that means something is happening.
Yeah.
But it doesn't like leave me immobile or anything. As far as like my spine, I have a lot of issues with my spine. And so she works literally each vertebrae up the spine and can tell where things are going on, as I mentioned before. And
Wow.
I can definitely notice a difference with pain in my back.
Hmm.
Um, so that is a definite plus. As I mentioned, some of the issues that I'm dealing with are neurological, and I definitely notice a difference with improvement, in cognition and things like that as well.
That's awesome. Hey, can you tilt your camera down slightly? You're cutting off like below the nose.
Sorry.
Okay, perfect. Okay, that's much better. Um, all right. No, that's really cool. And I didn't realize that it was that particular, like she could actually go vertebrae by vertebrae on
Yes.
your foot.
Yeah,
So,
she even, like I said, this last time mentioned a specific spot that had a little more inflammation than normal in my
mhm.
mid back where I have an injury. And I'm actually doing another modality that we'll talk about at some point that
Yep.
we've been kind of focusing in on that area.
Yeah,
And so it was interesting without me even mentioning that I had an injury there, that she was picking up on the movement in that area and the bit of inflammation that I had that hadn't been there before from
that's
us
way
working
cool.
in a different type of treatment.
That is awesome.
Yeah.
Okay, so then for the viewers, if I'm a viewer that just stumbled across this video and didn't know about foot zoning before, what kind of person do you think should definitely try this?
Um, I honestly think it would be great for anyone to try. Um, our bodies talk more than our mouths a lot of times.
Yeah, that's a good one. I
And
like
and our body tells things that maybe our mouths or our minds won't.
that. Mm,
And I mean, she has, I say, because we chat the whole time, as I
yeah,
mentioned before, when she's working my feet. But I said, do you ever have someone come in and like they don't ask you questions or they don't talk to you at all or anything? And or you like they don't want to hear what you're finding in their
yeah.
feet? Because sometimes, like, I mean, she's using it and I'm saying, oh, what's that? What's that? Tell me
You're
what that is
curious.
and tell me what
Yeah.
I need to work on. And, you know,
Hmm.
and she says, obviously, you'll progress faster if you do other things that she's, giving you tips and tricks on,
Hmm.
in addition to the foot zoning. But she said she does have a couple of clients, and they tend to be men that don't want to hear anything that she has to say. They don't want to hear what's wrong. They don't want to hear what she's finding. They just want her to work their feet. And because eventually, like, the foot zoning treatment will correct whatever's going on, but some clients, some patients don't want to know. They just want the treatment. They want to know
I
that they're
wonder.
being treated.
I wonder what convinced them that it would even work if they don't know what she's doing.
I think in that instance, there's two for sure of those clients that she didn't talk about like who they were or anything, but
Yeah, in general.
for
Yeah.
privacy's sake. But I think one of them, she mentioned the wife having really good results, and so the husband agreed to, and the other one was a referral from another holistic provider.
Oh, gotcha. Okay, gotcha.
So, yeah.
Um, yeah, and so yeah, it sounds like you said, it could help anybody, even somebody maybe that has emotional traumas.
Oh, for
Um,
sure. Yeah, physical and emotional issues, absolutely.
that's
Yeah.
really cool. Yeah, it's kind of nice if you can get a good cry and you don't even have to talk about your past.
For sure.
That sounds like a good therapy to me.
Well, and
Um,
I will mention, I don't know if this is in your question, sorry,
no,
but
it's good.
there is a national foot zoning site that you can go and search practitioners in your
Oh,
area.
okay.
It doesn't necessarily mean it'll pull up everybody that might do a practice of sort. And I had mentioned when I first started seeing Christina that I had tried to do a little bit of research on it because another provider of mine referred me to her, so I didn't really know a lot about it.
Hmm.
But I do have specific neuropathy in my feet, and so I like mentally thought, okay, yeah, having my feet worked on would make sense.
Yeah.
And there wasn't a lot that I could find that was really specific. And she said that's because it's like there's the protocol and procedure for each foot and how you do it, but that practitioners obviously put in their own
Speak on it.
selves into it too. And so if I see her versus someone else, it might be a slightly different thing, even though the protocol is the same.
Okay.
So yeah, I mean, would it be interesting to try someone else? Sure, but so far
Yeah.
I've had great experience with the practitioner that I have. So
Yeah. I wonder if it would help somebody that has, well, when you mentioned neuropathy, I also thought about people that have cold feet all the time, like circulation issues.
absolutely. Hmm.
Yeah, it makes sense it would.
Yeah.
Um,
I've
Really
actually noticed quite an improvement even in my blood pressure and things like that from
cool. Okay.
treatments.
Would you say it's another one of those holistic modalities that insurance usually doesn't cover?
Absolutely. It is
Okay.
out of pocket. And again, each practitioner probably has their own price range, but I would say around $75 to $100 per session is pretty average.
Okay. Yeah, they're spending a whole hour, so that makes sense.
Mm-hmm.
Um, and all ages is fine. Does she work on kids?
She does work on kids. Yep.
Okay, cool. Well, I don't think I have any more questions. It sounds similar to reflexology, but like you said, the overall aim of it is not per symptom or per organ.
Right.
It's to connect the body, like everything together, every treatment.
Right.
Not,
And it does work specific things as well as it's doing that, but it's doing it in a way as to connect the whole body together so it can work to heal itself as a whole. And again, it's not working just the muscles or the reflexes. It's a deeper process than that.
yeah, and yet your muscles can be sore the next day.
Yes.
Not just
But
your
not
joint.
in my feet. Like they're sore in the areas of the
Right.
body that she's
The
working.
actual muscle.
My
Yeah.
feet have never been sore the next day.
Oh, that's interesting.
Yeah.
Okay, that's a good point. Yeah, you don't feel like super tender for the next week.
No, not at all.
Okay, very cool. Well, I love it.
Yeah.
Do you have any other thoughts that you want to bring out besides,
I
so you don't have questions come to
think
mind?
so, except that honestly, I like exploring different holistic treatments
Yeah,
that
I'm
work
glad
with
you
the
are.
body, and this is one of my favorite ones. So I may not always be able to do it or afford it or do it as often as I would like to, but it's something I could see myself definitely going back to again and again. And I have
Yeah,
been
maybe a
consistently for
maintenance
several months.
program at some point. Yeah,
Yeah.
quarterly or something like that.
Yeah, she said a lot of patients will see her consistently for a period of time and then go to kind of a maintenance where it might be once a month or once a quarter or once every 6 months, and everybody's different.
That's really cool. All right. Well, you've been amazing as always. Thank you so much for explaining to us in detail all about foot zoning. And yeah, I encourage the users, if you're curious about it, to, like Julie said, look up that website. Did you say you knew the exact name of the website or just simply search it?
I should have looked it up. I do not. I apologize. But if you look up the foot zoning provider in my area, it'll pull up the National Registry site.
Cool. Is it one word or two words?
It's one word, foot zone or foot zoning. Yep. And side point, which you may be going to mention already, I don't know. But there is presumably and hopefully going to be an interview in the future with my practitioner, with Sarah.
Oh, yes.
So I'd just like to give her a little plug, I guess. So if you like this video, definitely come back and watch the video with Christina that
Yay.
Sarah will be doing in the future.
I can't wait. I can't wait to interview Christina. That'll be really fun. And you've got me curious now. I'm going to have to go on and see if there's one in my area to just to try. No, you're amazing, Julie. I'm so glad that I mean, it sounds bad to say I'm glad you're on this health journey, but I mean, I am, because it's intriguing. It's fun to live vicariously through all the different things that you're doing and to be able to find out what's working and maybe what isn't.
Sure.
And I just love how open-minded you are and willing to try things, because in the name of health, you want to feel better.
Yeah.
And after enough time has gone by with trying all these different things you're trying, we'll have a really good idea on what works, and we'll be able to share that with our audience. So, thank you again, and until next time.
Okay.
Bye.
Bye.